can men still ejaculate with a cock ring on? This is one of the most common questions I get asked from patients here at Restorative Health Clinic. There is a lot of misinformation out there about safety and function. I'm Hadley Barrett, a nurse practitioner and a clinical sexologist at Restorative Health Clinic. Today, we're breaking down exactly how these devices work, how to use them safely, and why using the wrong materials could cause permanent damage. A penile constriction band is typically worn at the base of the penis, like this one. The most effective constriction rings can be worn both around the base of the penis and also the scrotum, as you can see here. A constriction ring's main job is to trap blood in the shaft, helping men stay harder for longer. This is a huge win for men who are looking to increase their stamina. Ejaculation comes through the urethra, which is where your urine or your wee comes out and is located in this part of the penis. A well-designed constriction ring like this one from FirmTech doesn't block the urethra or exit at the tip, unless you want it to. So semen can still come out when a guy has an orgasm if he doesn't over-tighten it. It may be a bit slower than without one. Interestingly, guys who wear constriction rings report an increase in the intensity and duration of their performance. I'm not a bloke, so I can't speak from experience, but my patients can, and many of them say wearing a constriction ring makes the experience feel even better. Constriction rings are straightforward and easy to use correctly, but bear in mind that using one incorrectly can cause short and long-term issues. If the ring is too tight, it might block your urethra and reduce or delay ejaculation, which may be desired in the case of premature ejaculation or climacturia. If the ring is worn for too long, men may experience numbness, discomfort, or reduced sensation. If a ring is placed halfway up the shaft instead of at the base, it really can mess with how things feel. I should also mention that these are not a contraceptive device, so don't wear one of these if you're trying to prevent pregnancy, because it won't work. I've heard reports of men trying to use all sorts of things they find around the home, like elastic bands, even O-rings in place of medical constriction rings. But if you don't want to risk tissue damage, please avoid doing this. Comfort matters when it comes to wearing a constriction ring. Use common sense, listen to your body, and stick to wearing a constriction ring for around 20 to 30 minutes at a time, unless you're using one of these FirmTech rings, which you can safely wear for 90 minutes. At Restorative Health Clinic, we recommend an adjustable silicone band like this FirmTech MaxPR as part of managing erectile dysfunction, premature ejaculation, and to support recovery after prostate cancer, and helping for issues like climacturia and arousal leakage. So can men still ejaculate with a constriction ring on? Yes, they can, if worn correctly. They can also have a firmer erection for longer and have a more intense, longer lasting experience. Honestly, it's a helpful tool for men to use when managed correctly. If you're curious to try this out for yourself, I've put the links to medical grade devices we recommend to our patients at Restorative Health Clinic in the video description. See you in the next video.